Hi, welcome to the Fit and Healthy Today show. And I got a little bit of inflammatory tracheitis, so you'll have to bear with me if I don't come out as clear. I'm doing the best I can. I usually pick my subjects based upon the amount of customers that come in with various issues throughout the week and just let God guide me. And for some reason, it seemed to be this issue, genital herpes. Kind of a delicate issue, and I'm going to handle it in the best I can. The most common venereal disease now out there. It affects 35% of our United States population, with 80% of that 35% being between the ages of 20 and 39. So chances are good, if someone's in that age category, you got a 50% chance of coming in contact with someone who has genital herpes. Now, it will lay in remission along the spine, and it's not contagious at that time. But when it comes to fruition and it breaks out into the little recurrent types of blisters, it's highly contagious. So in a woman, sometimes it may be difficult for a guy to see, but a woman can usually see it in a man. Men will get little sores on the penis, and they'll also have a discharge. If they're in the early discharge state, you might not always know if they have an infection in that regard. So protection is until you know whether or not somebody has had that, and hopefully honesty in speaking about it. A lot of people hide it and conceal it because, you know, obviously it's not a pretty sight when you look at it. And you can take a peek and see what it looks like online if you want to know what you're into. It is not curable to date. It is controllable. And there are medications out there that have quite a bit of side effects that are antiviral agents, but there are some natural ways that we can control it with diet as well as supplements that can keep the reoccurrences down to almost bare minimal, unless there's really something that triggers it, and we'll talk about the triggers. It increases the risk of cervical cancer, so if you've got it, what happens then under those circumstances when you have it will increase your risk. So being aware of that, you need to be very cognizant of getting your yearly pap smears if you have genital herpes. In infant times, it increases the risk of blindness. So for example, if a mother has an outbreak at the time she gives delivery, oh boy, if that comes in contact in baby's eyes, it can cause blindness, it can cause death. So if you have genital herpes, you need to let your OBGYN know that you have it, and if you have or suspect any type of outbreak, you have to have a C-section. That's just all there's to it. Highly contagious, and we don't want baby catching it in their eye and go into their brain or their nervous system. Very, very dangerous, okay? Root causes. Obviously, sexual contact is the main way it's transferred. But believe it or not, you know, the old stuff they taught us back in school, that you can't catch venereal diseases from a toilet seat, we're kind of wrong about herpes. So use the covers when you're sitting down on the seat as best you can, or if you've got the sanitizers. This is contagious, and it's been shown to live up to 4 hours on toilet seats. So no putting the butt down on the toilet without the protection, okay? Immune system suppressed. It will trigger and it will come about when the immune system gets suppressed because of stress. You overwork, anxiety, you have a high fever. Women who are menstruating, they get under physiological stress. That also increases the risk of an outbreak as well, too. Nutritional deficiencies. If the L-lysine, L-arginine ratios, and those are amino acids, if you end up with a higher ratio of L-arginine to L-lysine, that can also trigger it if it's laying there on the spine, and it can trigger a recurrent outburst. When we're talking about the things that we can do to prevent, which we have obviously is protected sex, but once you have it, the things that keep it from reoccurring, diet and supplementation, they work. I have, we've had our stores for 13 years, and I know here in Lompoc, I've been there for 8. And I have customers that came into me years ago, some of which have never had a reoccurrence. And they would get it, and they would come out every 3 to 6 months. Particularly seems to be more so in the winter months. Just seems to happen. Same with cold sores, which is herpes simplex. It's a virus 1, whereas the genital is a virus 2. The diet. So knowing that if you have too high of an arginine ratio to L-lysine, under these circumstances, we want to eat L-lysine-rich foods. And you know, in the olden days, they used to say avoid chicken and turkey and all of that if you had cold sores or genital herpes outbreaks, but actually that's not the case. The foods that are rich in L-lysine include beans, turkey, fish, chicken, and lots of veggies, lots and lots of veggies. You want those veggies in there particularly to alkali the blood, because when you're in an alkali state, your immune system is going to be at its optimal level and you're not acidic. So if you turn around and you eat acidic foods such as tomatoes, sugar, red meat, alcohol, or once again if you have these other triggers, but from a dietary standpoint, alkaline the blood. If you feel any tingling coming on, and obviously the symptoms of this include burning, itching, a sensation of reddening, or any tingling coming down in that area or formation of a blister, you want to immediately get that diet under control with the L-lysine and arginine ratios. That can stop it from progressing and help it go back into the spine and sit there and wait for the next time. Hopefully there not being a next time. You want to avoid arginine-rich foods such as chocolate, peanuts, wheat, and almonds. I know almonds are essential fatty acids, and we want good fats in our diet, but for some reason, those particular offenders, avoid them like the plague because they're high in L-arginine, and when you get those ratios off again, then the herpes, be it cold sores or be it genital, will come to fruition. It can be very, very painful. And actually, there's a lot of people who require psychological counseling once they get genital herpes, because it's all of a sudden the sex life changes, the way you have to handle and deal with your diet. There's a lot of additional amounts of changes that have to occur. And if you abide by the dietary changes, it really will help and keep these reoccurrences from occurring. The supplements, and the ones I've listed on here are the ones that are researched. And if you know me, I always give you the research that backs it up. To me, the science is important. The voodoo medicine, I don't care about. L-lysine, 1,000 milligrams 3 times a day on an empty stomach if you have an outbreak, immediately on an empty stomach. And I have doctors who say, oh, that's where. No, because once again, remember how we talked about that L-lysine-arginine ratio? We want to get the arginine ratios down and the lysine ratios up. There's multiple studies on this. I mean, multiple university studies that support that it reduces the pain, shortens the duration of the virus as well, decreases the frequency and lengthens remission. And remission, we want it sitting back in there. We don't want it coming out. Because once again, when it's in remission, not contagious. Ester C. Now remember, I'm not a fan of ascorbic acid because it only stays in the body 2 to 4 hours and it excretes calcium out of the bones and you pee it out. Ester C is a mineral ascorbate vitamin C. 1 to 2,000 milligrams 2 to 3 times a day. Really helps you fight infection and it aids the healing of the skin. Because remember, our skin is this pliable, flexible, collagen type of fibers, cells. Well, vitamin C helps stimulate collagen production, so it helps it heal. But from an immune standpoint, despite what the AMA may say, tons of studies on vitamin C in the immune system and on vitamin C in all herpes viruses, including cold sores. Well, I mean, we can stop them. Boom. L-lysine and vitamin C I've seen stop, boom, in its tracks. Immediately stop the herpes from coming to fruition. B complex. A good multiple in combination with higher amounts of B helps the skin tissue repair. And the Bs, remember, we talk about them in just about everything. The Bs help you deal with stress, both physiological and psychological stress, besides helping with other mental disorders and other things. But once again, since stress is one of the main triggers of genital herpes, keep those Bs high, particularly if you have a stressful environment. You're a working mom, a stay-at-home mom, or you got that hard-pounding a job with a lot of stress, or the desk job as a computer scientist. Zinc, copper. Now, a lot of physicians will send people in to come and get zinc for their immune system, and I'm like, okay, that's good. But remember, zinc offsets copper. So if you're taking zinc for more than a week, in excess of 30 milligrams, you need to be taken at a balance with 1 to 3 milligrams of copper. Zinc stimulates the immune system. It also aids in skin healing. There are actually zinc creams, and I know at our store we have these herpes creams that people come in and grab that can help heal it as well, and most of them are zinc based. Zinc aids the healing in combination with C and E. Vitamin A. Now, there's some studies that came out about vitamin A, I think that Ralph mentioned in our last show, about the lighter skinned you are, the poor absorption you have of beta-carotene sources. So there's a lot of people in this country that are vitamin A deficient because they're told they don't need a multivitamin. Vitamin A helps with the immune system. And if your immune gets compromised with whether it's a herpes simplex virus, coronavirus, whatever it is, increasing the vitamin A really helps you fight off infection. Staph infections too, there's a lot of research on that as well. So you can increase your dosages of vitamin A as long as you're not pregnant for a short duration in order to bolster the body's ability to fight off infection with a combination of vitamin C. Probiotics, the good bacteria. Now I've mentioned before that 80% of your immune stems from in your bowel. And that means eating good foods and drinking a lot of water and having a high enough fiber diet. But it also means keeping these good little critters, probiotic meaning pro-life, having adequate amounts of these good bacteria. If you don't have adequate amounts, you're going to get sick. It's not if, you will. So if you go on an antibiotic, oh boy, one of the biggest things I've seen to trigger this is, besides the diet or the ratios of arginine to lysine, is antibiotic usage, because it makes you very acidic and it kills all your good stuff off, so your immune system just goes kunk. So on an antibiotic, which means anti-life, you take a probiotic, which means pro-life, and that will get those bacteria laying in there again. Lemon balm extract or cream. The studies supported fewer outbreaks and fewer symptoms. So if you feel that tingling come along, and the same that goes with L-lysine creams as well. But lemon balm I found quite a few studies on. Topically applied in a tincture or a cream helps healing, and it prevents the outbreak from coming to fruition. So that's the whole point. If you know it's coming, prevent it from coming to fruition. Propolis tincture. Now propolis is a bee product. And there you can do the tinctures, or there's ointments that you can get that have royal jelly. And propolis has a way of stimulating certain enzymes in the skin to help with healing. You're even finding it in some of the beauty creams nowadays for anti-aging, because it's an antimicrobial. It kills viral, fungal, and bacterial infections. It's what the bees use to help kill off the stuff in the hives. So it also helps kill infection and speeds healing as well too. There's a homeopathic called Nozoda, and not real common. You don't usually find it in the stores, and it has to be special ordered. But this homeopathic medicine stimulates immune response specifically to herpes. So you're going to have to probably special request it ahead of time in a good local health food store so that it can be on hand when you come out with an outbreak, because boy, it can sure stop it in its tracks. Licorice root. Now, licorice root has so many studies for so many different things. We talk about licorice root for ulcers. We talk about licorice root for irritated bladder issues, stomach, adrenal glands. Licorice root kills viruses, bottom line. And I'm not just talking about herpes, but herpes, if it is internally taken, licorice gets in the body, and it'll kill off and also help with chickenpox herpes. Any type of herpes viral, it will attack. The only problem is, if you've got high blood pressure, you have to do a diglyceride licorice, which removes some of the key components out of it that can trigger blood pressure issues. I actually have people come into the store and ask for licorice root in order to raise their blood pressure, and some success in that regard for those people who have real low blood pressure. Super green foods. Remember we talked about in the diet, you want to alkali with the vegetables. Super greens, coriella, spirulina, wheatgrass, barley grass, they're alkaline agents. And when you alkali the blood, your immune system is better able to handle whatever invades it and to respond quicker. So if you're not a good vegetable eater, you better be doing some powdered vegetables that are enzyme rich, super green foods, things like that to alkali the blood. There's a little known product called humic acid. There's a couple of different brand names it comes under. But it's extremely antiviral. Whatever the virus is, it can attack it. Some studies on that. You can check it out a little bit more online, but we're kind of limited on time, so I don't have as much detail for you. You can buy that in a good local health food store. It has to be taken on an empty stomach. But humic acid has been researched for AIDS, has been researched for herpes, and other types of viruses as well, too. Anyway, I hope this helps. Next, we're going to be moving on to the fitness portion of our show. Thank you very much. Hi, welcome to the fitness portion of our show, and we're working on our last chakra, the 7th chakra, which is called the crown chakra. Now, when your crown chakra is balanced, your connection to God, to your creator, your source, whatever your religious beliefs be, is intact. You'll have trust, you'll try to help other people, your confidence in yourself is good. There's a real balance because there's almost like an energy that comes from above and shoots down into the body. When you're out of balance, obviously you'll have the opposite. You'll be disconnected and you'll always feel disjointed, like something's missing. So rather than do some yoga moves on this, I have a move that I think is much more effective that gets practiced on me, and I use it on my children. And it's from Shinjin Jitsu. And we have a volunteer in Greg, and he's going to let me demonstrate on him. Now, once somebody does this for you, got to move back just a little. Once somebody does this for you, you will never want them to ever stop again. What you do is you gently grab behind the head, and hopefully this shows out. And there's like a little crevice right behind the cranium, right back here. Hope you can see my fingers moving there. And what you're going to do is you're just going to sit and hold that there for the person. You're going to hold that area. And what sometimes people report is they'll see bright lights, they'll see color variations. All of a sudden, their mind just seems to calm. I usually tell them, if you do this, obviously you want to have a partner, a friend, or a husband, wife, boyfriend, girlfriend, and they can hold it and you can do it for each other. But after a long, hard day where there's a lot of stress, if someone can hold the back of that area for you for a few minutes, they're not going to want, once you have this done, you don't want to let it go because it brings some peace and some connection in to you. So give that a try. I hope that helps. And have fun. Next, we'll be moving on to the research portion of our show. Thank you. I know, Greg doesn't want to get Hi, welcome to the research portion of our show, and once again with us is Ralph Turchiano. Ralph?
Thank you for that intro. Well, in regards to ADHD, or what appears to be the epidemic of ADHD, could there be something in the environment spurring it on besides just diagnosing it more? Well, in November 15th, in the issue of Biological Psychiatry, they discovered something quite interesting: plastics. There's a chemical in plastics called phthalates. Don't ask me how to spell it. It's not spelled exactly the way it sounds. They said, quote, they found the significant positive association between phthalate exposure, again, phthalates from plastics, common plastics you find every day, and ADHD, meaning the higher the concentration of phthalate metabolites from plastics in the urine, the worse the ADHD symptoms and test scores. They drew a direct, not a correlation, but a causative effect of plastics to ADHD. They said, quote unquote, and this is from Dr. Shol Yang, explained that these data represent the first documented association between phthalate exposure from plastics and ADHD symptoms in school-aged children. The editor of the Biological Psychiatry also commented, the emerging link between phthalates and symptoms of ADHD raises the concern that accidental environmental exposure to phthalates may be contributing to behavioral and cognitive problems in these children. They definitely need more research. What's holding up the research? The Centers for Disease Control, which in 2005 didn't seem they were that interested in any connection between plastics and ADHD at that time. So while they sit on the laurels, it's something for you to think about. Again, this is plastics from drinking bottles, from soda bottles, from plastic forks, spoons, everything you normally see in the environment. This is common plastic, nothing fancy or special. Something to think about. And maybe it would be interesting too if you remove those plastics from the child's diet for a week or two to see if the ADHD symptoms improve. I'd be curious about that. That'd be an interesting study to follow up on. Vitamin A. Remember how they demonized vitamin A? Well, scientists at Newcastle University found out that a lot of women are very deficient in vitamin A. This came from Britain, of course. They said, quote unquote, and this is the reason why, almost 50% of the women have a genetic variation which reduces their ability to produce sufficient amounts of vitamin A from beta-carotene, meaning chances are they need to get their vitamin A from a meat source, fish source, or something along those lines. But regardless of that, even then, they were still only getting 1/3 of the dietary recommended amount of vitamin A in their diet to begin with. They pointed out, this is Dr. Leitz, shows that for many women, the beta-carotene is not an effective substitute for vitamin A, quote unquote. Why is this important? It boosts our immune system and reduces the risk of inflammation, such as those associated with chest infections. What our research shows that many women are simply not getting enough of this vital nutrient because their bodies are unable to convert the beta-carotene to a proactive form of vitamin A. They looked at 62 women, and 29 of them, 47%, were totally deficient in it. Again, even when they looked at their entire diet, they were only getting 1/3 the recommended daily amount of vitamin A to begin with. So you have two choices. Either you grab yourself a good, decent multivitamin, not be so scared of the vitamin A, or you look at your food labels. I'd probably just do the multivitamin a little easier, a lot safer. Aspirin, Tylenol. A lot of you guys take aspirin on a daily basis. Well, recently an article came out from the University of Missouri that basically discovered that aspirin and Tylenol somehow stunt the effect of vaccines. Meaning, when you take aspirin and Tylenol, your body is not producing an antibody response to these vaccines the way it should be. Meaning, if you get a vaccine from swine flu, whatever it is, flu vaccine, pneumonia vaccine, it just doesn't seem to work as well, especially for those of you who take those two medications on a daily basis. What did they discover they did? They discovered this, and quote unquote, these drugs block the enzyme COX-1. Remember a long time ago in Celebrex and Vioxx, you heard about COX-1, COX-2 inhibitors? They block the enzyme COX-1, which works in the tissues throughout the body. We have found that if you block COX-1, you might be decreasing the amount of your antibodies is producing, and you need high amounts of antibodies to be protected. They also admitted they really don't know all the side effects, long-term or short-term, to the aspirin or the Tylenol. They also said this too, that the Missouri researchers said, the study and the regulation of inflammation and how that leads to the development and prevention of diseases. Many diseases, such as arthritis, cardiovascular disease, and diabetes, are all chronic inflammatory diseases. Now here's the catch. Listen very closely. Again, this is in regards to aspirin and Tylenol. Contrary to previous belief, inflammation is generally a good thing that helps protect people from infection. Many of the non-steroidal drugs that treat inflammatory conditions reduce antibody responses, which are necessary for treating infections. Now that's the irony. You take aspirin and Tylenol because you think you're trying to keep yourself healthy, you get yourself a couple of vaccines or whatever it is, and not do much of anything. In fact, that aspirin on a daily basis you're taking for general health, you may have to reconsider over time. Because if this article is correct from the University of Missouri, then basically that means you're more prone to get sick compared to a person who's staying away from those anti-inflammatory medications. If you don't need to take it, then why do it? Think about it. Aspirin is not a vitamin, it's not a nutrient. It breaks something to fix something. A miracle drug, yes. Made to be taken on a daily basis like a vitamin, I would rethink that. Now we go to chicken. Now I always like for looking for good alternatives to basically prescription drugs. And this prescription drug alternative is methotrexate. Methotrexate is often used as one of the only few tools they have to treat rheumatoid arthritis. Well, in the Biomed Central Open Access Journal to Arthritis Research and Therapy, there's tons of good studies out there. They just don't make the news. A lot of doctors are working really hard. Patients who received a 12-week course of chicken collagen II capsules showed significantly improved joint function with fewer and mild adverse effects than those taking methotrexate. In fact, the researchers basically, this was a randomized controlled study also. Indeed, the researchers said, quote unquote, indeed our work confirms that treatment with oral chicken collagen II leads to the improvement in arthritis with no significant side effects. So before you grab that bottle of methotrexate, why don't you try a simple bottle of chicken collagen II and see how that works. Yeah, so much for alternative therapies in that one. Physical activity. Seems like every time you open up the newspaper, there's something trying to discourage you from exercising for whatever reason. Well, they finally came conclusively that physical activity does extend lifespan. They looked at athletes, and this is reported in the Circulation Journal of American Heart Association. They found out that people who are physically active with intense exercise, not just guarded, but intense exercise, tend to have what's called longer telomeres. And what happens with the telomeres, if I'm pronouncing it right, the longer they are, basically the more cells can replicate, the longer you live. The shorter they become, it's kind of like a fuse, the less likely your body's to be able to produce new cells. The more exercise you have, the greater the telomerase enzyme you produce, which seems to protect these telomeres. And they said, quote unquote, this is direct evidence of an anti-aging effect of physical exercise. Physical exercise can prevent the aging of the cardiovascular system, reflecting this molecular principle. The fitness level of the athletes were superior to untrained individuals. The athletes had a slower resting heart rate, lower blood pressure, body mass index, and a more favorable cholesterol profile. Long-term exercise training activates telomerase and reduces that telomere shortening in human leukocytes. The age-dependent telomere loss was lower in master athletes who had performed endurance exercise training for at least several decades. Next time you open up that paper and they're trying to say exercise doesn't make a difference, why don't they actually start looking at research instead of hearsay? Now, how many of you think that GERD is caused by stomach acid? Well, this came out of the UT Southwestern Medical Center research. They discovered this, that quote unquote, rather, gastroesophageal reflux spurs the esophageal cells to release chemicals called cytokines, which attract inflammatory cells to the esophagus. It is those inflammatory cells drawn to the esophagus by cytokines that cause the esophageal damage characteristic of GERD. This condition is manifested by symptoms such as heartburn and chest pain. They said, quote unquote, it didn't make sense that acid caused ulceration of the esophagus. And this is what they said. That doesn't make sense if GERD is really a result of an acid burn, as we're all taught in medical school. I'll continue this article next time. And thank you.
Thank you very much, Ralph. Very good information. Once again, do your research. Thank you for joining our show. Bye.